Hey, everybody. I am so sorry I'm late. This is Nurse Eunice. And when I tell you that this Monday has Monday like no other Monday has Monday. And so I am so happy that you are here for another Monday Night Live. That is right. We're going to be doing our practice CNA test. And tonight's test is on medical terminology. So you don't want to miss it. Again, I'm sorry I'm late, but I am here now. And guess what, everybody? We are in our new office. And if you didn't know, our new book is out. That is right. So this is our CNA Exam Prep Workbook. And even though it says it is based off of the Florida standard, let me tell you, it's for all states. It's not just for Florida. It has so much information. And so you can purchase this book by going to nurseunice.com, or you can purchase it directly on Amazon. And so everybody, we're going to get started with our test. If you can hear me, let me know. We're going to get started in 3, 2, and all right, let's go. All right, so if you can see me, or if you can hear me, because I don't see any comments, I want to make sure that you all can see me okay. There we go. Now I see everybody. And so the QR code that's on the screen is a way for you to purchase our book. Just use your phone. You're going to hover over with your camera app open, and you can scan that code and purchase the book. And we're going to have a Black Friday sale on Friday, so stay posted. Hey, Mega Girlful. Yes, now I can see my comments, finally. If you're interested in doing more than CNA, let's say that you want to do online medical assistant. Look, our online partnership with Career Step, it provides phlebotomy, EKG, and MA all in one for one flat fee. And so you go to floridacareeracademy.com to find out more information, but you can do more than CNA, and you can study at your own pace, and we help you with your clinical site placement. That's right. It's not just for Florida. It is for nationwide. So if you want to learn EKGs, phlebotomy, and also clinical medical assistant, you're going to go to floridacareeracademy.com, just scroll down to the bottom and click on the program that best fits your needs. And now it is time for our medical terminology practice test. And so studying is better with friends. So I'm gonna need for you to go let your friends know that, hey, to join in the YouTube. Nurse Eunice is on right now. And as we go through, I want you to choose the best answer, okay? For each question, put your responses in the chat, and good luck. And then Kay says she wants to be an LPN. Remember, to go from CNA to LPN is just 1 year, and I know you can do it. All right, so question number 1, team. The term eczema refers to, is it A, a contagious skin infection, B, a chronic skin condition causing inflammation and itching, C, a cancerous skin lesion, or D, a painful blister caused by burns? What do you think we mean when we say a patient has eczema? What does that mean? All right, put your answers in the chat. Revealing the correct response in 3, 2, and that is right. YouTube and TikTok, everybody has the answer right. It is B. So condition causing inflammation and itching. So eczema is a non-contagious skin condition characterized by redness, itching, and sometimes blistering or peeling. But let me tell you this, you're not a dermatologist, you're not a doctor. So if somebody glove up, all right, so I don't know what they have, you don't know what they have. And so until it's diagnosed, protect yourself. Let's go to question number 2. Question number 2, the suffix itis refers to, is it A, tumor, B, pain, C, disease, or D, inflammation? What are we referring to? Yes, Spica. Yes, Black Scorpion Queen and Mega Girlful. And yes, Trula. Everybody has it right. I had to take my hide my image because it was slowing down our connection. So yes, itis refers to inflammation as in arthritis. Great job. Question 3. The word cyanosis refers to, is it A, blue discoloration, B, yellow skin, C, red spots, or D, loss of hair? Hey, Emily. When cyanotic, what are we talking about? And I see so many correct responses. So, yes, you are right. When we say a person has cyanosis or they're cyanotic, that means they're turning blue. Bonus point, and I don't have any chocolate or any candy to give you. Black people don't turn blue. So we have signs of low oxygen. How do you know if we don't turn blue? Put it in the chats. Let me know. Because we're dealing with people with different complexions, and Black people don't turn blue. So let me know what your responses are. How would you know if your dark-skinned Latino, your dark-skinned Asian, your dark-skinned African-American client, if their oxygen levels were low, if we don't turn blue? All right, I see people saying purple. Oh, Mega Girl said check those nails. That is right. We're going to check the nails. So capillary refill, maybe the hands are cold. You all, we get kind of grayish. You're going to tell us not our normal color, but it won't be blue. All right, let's keep going. And then yes, Happy, it is gray also. All right, so question number 4. The root word hepat, H-E-P-A-T, refers to, is it A, stomach, B, heart, C, liver, or what do you think? What do you think? Hey, you all. So hepat, H-E-P-A-T. What are we talking about? And the crowd goes, wow, I see you watchful eyes. She says, C. So yes, anytime you see H-E-P-A-T, that refers to the liver. So hepat is the root word for liver, as in hepatitis. We put those words together. Hepa, that would be liver. Itis would be inflammation. Hepatitis. Question 5. The medical term for difficult swallowing, is it A, dyspnea, B, dysphagia, C, dysuria, or D, dyspepsia? Oh yeah, these are some big words, and you all are going to learn these words too. You have no choice. You have to learn them because it's going to be in your patient's chart, and you have to be able to say the words. And so yes, everybody, give yourself applause. Great job. It is B as in boy. So the image I have is of someone holding their throat and they're crying. It hurts. So this, the pre, and then the phagia refers to eating or swallowing. And again, because my connection is bad, I'm going to hide my image, but you all do know that I love you. So camera's going to be off so I don't slow down the live stream. Let's go to our next one. Question 6. The suffix ectomy means, is it A, repair, B, cut into, C, study of, or D, surgical removal? Ectomy. Oh, Renee, you're going to do fine because you're practicing, you're taking notes, and I know you're going to do well with your studies as a nurse. So keep coming back and keep studying. All right, so let's see, family. Oh, so we have a lot of people who chose B. We are torn between B's and D's. So does ectomy mean to cut into, or does it mean to remove? We're half and half. What do you think? Revealing the correct response in 3, 2, and ectomy is the removal. That is right. So think about tonsillectomy. Whenever someone has a tonsillectomy, they're not cutting into the tonsils, they're removing them because they were chronically inflamed and infected. Question number 7. This is an easy one. Tachycardia, does it mean A, fast heart rate, B, slow heart rate, C, irregular breathing, or D, heart attack? What does tachycardia refer to? I see you, Spica, and is it Nos and Donay? And yes, everybody, perfect scores. It stands for fast heart rate. And I'm sorry I can't get the questions on the screen for TikTok. I'm not sure what happened, but if you go to YouTube, you'll be able to see the questions and you would see the image of this person with a fast heart rate. And so whenever you are taking care of a client, my CNAs, and if they happen to have their heart monitor on, this is what you would be looking at. And if you saw an irregular, you never leave your patient. You're going to stay with them. You're going to call that nurse. You keep them in the bed, because if their heart is beating that fast, then chances are they're not getting enough perfusion or blood flow. They're going to get dizzy and short of breath. So when you see a really fast heartbeat, you got to keep your patient in the bed. And the opposite is true also. If you see on the heart monitor, if you see something that's really slow, you keep them in the bed too, and you notify your nurse. All right, let's go to our next one. Will these be the same questions on nursing exams? No, they're not. They're not phrased in a way of how they would be on your CNA or your nursing test. But in order for you to answer the questions correctly, you have to know these basic terms. So how I just said, hey, the patient has tachycardia, the way it would be worded on your CNA exam is your patient says that they're dizzy, they're short of breath, and their blood pressure is 96/50. What's the role of the CNA? So you have to know what these terms mean. And your role is going to be to notify the nurse and to keep that patient safe, and you don't leave the patient. So you're learning the terms to help you understand the care concepts so that you know what to do when your patients have, their medical condition changes. Question number 8. What does the abbreviation PRN mean? Does it mean A, after meals, B, as needed, C, every night, or D, before bedtime? What does PRN mean? All right, finally it's showing. All right, what does PRN mean, everybody? Revealing the answer in 3, 2, and you got to see my face for this one, because 100% of you all got that right. That is right. It means as needed. Great job. So the correct response is B. Question 9. What does osteoporosis mean? Is it A, shortened bones, B, bone infection, C, porous bones, or D, bone growth? Osteoporosis. We're learning these terms tonight. Thank you for the gifts, everybody. Thank you. Osteoporosis, what does it mean? All right, for this one, it does not mean bone infection. When someone has osteoporosis, poor. Give me a different answer, Danita and KN. That's right. There go the answers. Their bones are porous. Their bones have little holes, little openings, which means that person's going to be at a higher risk of doing what? If their bones are weak because they have little openings in them, they're going to be at a higher risk of, putting it in the chat, everybody. Are they going to be at a higher risk of staying safe? Absolutely not. When someone has porous bones, osteoporosis, they're at a higher risk of falls. So whenever you see, that's right, watchful eye, their bones break easily. And so we have to be very careful with them. We're going to make sure we have those gait belts on. We have those shoes on their feet before we get them up to transfer them. Yes, they can be in a lot of pain also. And we're going to make sure they get what? What do they need? They need calcium. So All that stuff about dietary needs, that's what CNAs focus on. No, you don't diagnose, but you help to keep those patients with osteoporosis safe by making sure that you're following the safety precautions, and you're going to encourage them to eat some calcium, because that's going to help do what to the bones? It's going to help build the bones. All right, you go for your exam on December the 8th. You don't feel like you're ready. Beverly, you have time to get ready. And I am extra cautious of people who are overly confident. So the fact that you're here practicing, your test is almost a week away or a little bit more. I know you're going to do well. Just keep practicing, okay? And don't get distracted over the holiday. I need you to practice even over the Thanksgiving holiday. You said, let's see here. Hi, I couldn't hear anything from the live class. Is something I'm supposed to do? I'm not sure why you can't hear. I'm thinking other people can hear. Maybe go out and come back in again. All right, so that's right. I am just Mrs. Me. It is calcium and vitamin D. And don't forget that getting them up, walking them around, especially getting them out of some sunshine, that is going to help improve their vitamin D levels also. All right, let's go to question number 10. The root word neph, N-E-P-H-R, means, is it A, lung, B, heart, C, kidney, or D, liver? When you see neph in front of a word, N-E-P-H, what are we referring to? And everybody on YouTube got it right. Let's see what my TikTok family, N-E-P-H. When you see that in front of a word, TikTok, what does that mean? What does it mean? All right, for everybody who said kidney, you are right. It is C. And so neph refers to kidney, as in nephritis. They have inflamed kidneys, which is possibly caused by a UTI, urinary tract infection. Remember, whenever that urinary tract infection, whenever it starts traveling up, they can get a kidney infection. And so as a CNA, when you notice that that person's not drinking, or they're having painful urination, or maybe their urine is really concentrated, you want to be letting your nurse know, especially if you can smell it. If it's starting to smell like ammonia and it's starting to smell really strong, that is a sign of an infection. We need to stop it while it's a UTI. We need to stop it before it becomes a kidney infection. Question 11, easy. Hypoglycemia means, is it A, high oxygen levels, B, low blood pressure, C, high cholesterol, or D, low blood sugar? What does hypoglycemia mean? So we have our prefixes and we have our suffixes. The prefix comes before the word. So the prefix hypo. The way I remember hypo is that in college, I was so po, I couldn't afford the other OR. So that means my funds were low. Hypo, Eunice's funds were low. All right, so something is po, it's beyond poor, they're po. And now we're talking about glycemia. We're talking about the sugar that's within the blood. So for everybody who chose D, give yourself a round of applause. That is right. Hypoglycemia refers to low blood sugar. So if a patient is eating and their sugars drop below, some facilities will say 70, we consider that to be hypoglycemic. But look at your facility's policies. In some of your facilities, they do not allow the CNAs to do the finger stick, the glucometers, but in other facilities, they do. So it just depends on where you're working. When in doubt, notify your nurse. Let's go to question number 12. The prefix derm, D-E-R-M, refers to, is it A, heart, B, skin, C, brain, or D, muscle? Derm, what are we talking about? Oh, Nadena, I think that's your name. You're fast. I see you. So many correct responses. Hold up, I have to show this. Because like the whole lot of you said B. And so that is right. The prefix derm refers to skin. Oh, he's so adorable. He's so handsome. So whenever you think about DERM, think about dermatology, dermatologist. And so yes, that would be the study of the skin. Question 13. Hematuria means A, blood in the stool, B, high blood pressure, C, blood in the urine, or D, urinary tract infection. Hematuria. And don't forget, you can purchase our CNA Exam Prep book by going to, let me make this large. Hey y'all, by going to nurseeunice.com. Yes, our book is out. It is fantastic. And you all if you get a chance, go ahead and check out our new book. And yes, we'll have a Black Friday sale. So right now, this book, Black and White, is $21.99. It'll be cheaper on Black Friday. All right, let's see, family. Everybody got it right. That would be blood in the urine. So hema refers to blood, urea refers to urine. When you see something like that, what do? What could it indicate? And then what do you do afterwards? So I need two responses. What does hematuria indicate? And then what would be the CNA's response? When you see it, what do? All right, looking for a correct response between TikTok and YouTube. When you see peach or red colored urine, because it doesn't have to be gross, it doesn't have to be totally red. It can be a peach color. When you see something that's not yellow, it looks like it has blood tinged spots in it, specks of blood. I see everyone saying, tell the nurse. That is right. But what does it indicate? Sometimes you're going to see that whenever a patient has had a catheter. And so that catheter, that tube that's in the urethra, especially if they've been pulling on it, is irritated their urinary tract. And so when we remove the catheter, guess what? The urethra is still irritated. And so when they urinate, it's going to bring that blood-tinged urine out. You still have to notify the nurse, but I want to let you know some of the reasons that somebody would have hematuria. So injury, maybe their kidneys are damaged, maybe they had surgery, but more than likely they had a catheter recently. All right, and someone put kidney infection. That is right. Great job, team. And I see you all know to notify the nurse. Question number 14. We mentioned the color cyanosis, but what does it mean? So the term cyanosis is most commonly associated with, is it A, lack of oxygen, B, fever, C, infection, or D, dehydration? Cyanosis, when they turn blue, why did they turn blue? Great job. That was too easy for you all. Like everybody got it right. It is because of a lack of oxygen. So cyanosis is a bluish discoloration from oxygen deficiency. All right, question 15. Arthritis affects is it A, muscles, B, bones, C, joints, or D, lungs? Arthritis, what does it affect when your patient's like, ouch, I just want to stay in bed because everything hurts. Don't let them stay in bed because it's going to hurt worse. They have to get up. They have to start moving. When they get up and they start moving, even if you move them slower, that's going to improve the circulation to their joints. That is right for everybody who chose C. Arthritis. Arth refers to joint, and itis, again, inflammation. So arthritis would be inflammation of the joint. Great job. We're going all the way to 50, and right now we're on question 16. We have a few hundred people watching us between YouTube and TikTok. So the word embolism refers to, is it A, broken bone, B, a C-shaped blood cell, C, swollen lymph nodes, or D, a blocked blood vessel caused by a clot or air bubble? What does the word embolism refer to? Got it. Yes, embolism refers to D. So an embolism occurs when an embolus, which could be a clot or an air bubble, travels through the bloodstream and blocks a vessel. 17, pneumonia affects which organ? Is it A, brain, B, liver, C, lung, or D, heart? When someone has pneumonia, what organ or organs are we talking about? What do you think, team? What do you think? Yes, all of you have it. That's the correct answer. Let's see over here in YouTube world. Everybody has it right. So pneumonia affects the lungs. And so whenever your patients have their breathing apparatuses, we call them, put this one up, they're incentive So they have that device that has like an accordion mouthpiece. They're not supposed to blow. With incentive, they're supposed to inhale. And when they breathe in, it's going to expand their airways. It's going to make them cough. And it is not comfortable. When someone has had surgery or when they have pneumonia, the last thing they want to do is cough. But if they don't cough, what happens to that mucus? What happens to that fluid that's in the bottom of their lungs? It doesn't come out. So the nurse is supposed to do the initial teaching on the incentive spirometer, but I need my CNA babies. Every time you pass by that room and you see that patient is talking about, oh, I don't feel well, I don't want to get up. I'm gonna be like, Miss Eunice, let's get you to take a deep breath in on your incentive spirometer. And when they say, oh, it hurts, it makes me cough, you're going to tell them, well, we have to get that mucus up so you can, you won't develop pneumonia. Or if they have pneumonia, so you can get rid of. Question 18. Everyone's going to get this right. What does phlebotomy mean? Is it A, drawing blood, B, blood transfusion, C, blood infection, or D, swelling of the veins? Phlebotomy. Yep. I knew you were going to get that one. That's way too easy. So phlebo means vein. Tomy is incision. So vein puncture for blood draw. That is what phlebotomy refers to. Hey, fun fact or very creepy fact. Do you know how they did phlebotomy before modern medicine? It was called bloodletting. They would literally cut you, let the blood drain, and that's how they collected their blood sample. So, yep, now go talk to your teacher about that. All right, question 19. Glaucoma is a condition that primarily affects the what? Would it be A, heart, B, liver, C, lungs, or D, eyes? I see you watchful eyes. You were so fast. And I see Augustine and Chrissy and Nadena. Enough child Chidima. All right. So, and let's who we have over here. We have Lovely. We have Kimberly. So, yes, everybody, glaucoma affects the eyes. And so glaucoma is a group of eye conditions that damage the optic nerve, often due to increased pressure in the eye. 20, myalgia means, is it A, muscle weakness, B, muscle pain, C, muscle tear, or D, muscle rigidity? Myalgia. Oh, you got to know those prefixes and those suffixes. So when we say my, what are we referring to? Yes, Earth Angel. Hold up, Auntie. Auntie, you doing too much. That's my auntie. She knows these answers. All right. So does myalgia refer to muscle weakness, muscle pain, a muscle tear, or muscle rigidity? Revealing the answer in 3, 2, and yes, it is B. It is muscle pain. So algia refers to pain. And the MY, when you see that in front of a medical term, that refers to muscle. Let's go to 21. Dyspnea refers to, and that's spelled D-Y-S-P-N-E-A, but usually the P is silent. So dyspnea refers to A, difficulty urinating, B, chest pain, C, difficulty breathing, or D, fast heart rate. And thank you for the gifts, the hearts. I appreciate you all. And if you're on YouTube and you want to send us a super chat, we thank you for that also. Every little bit helps because me and my team stay up all day and all night creating content. So thank you. All right, everyone, the answer in 3, 2, and everybody who put C, you're absolutely right, because DYS stands for difficult, and then the NIA, remember the P is silent, refers to breathing. And so if someone's having dyspnea, what position should you place them in? You've called for me, you've called for the nurse. You put the blood pressure cuff on, you have the vital signs, you have the pulse ox on their finger, and now while you're waiting for me to get into that room, what position do you put that patient in? It's going to take me 2 minutes. You're in room 1 and I'm in room 31. Congratulations on passing your test. That's right. Upright, heads up, high Fowlers. All of those are the correct responses. Great job. Question 22. Neutropenia is a condition characterized by A, excess white blood cells, B, low oxygen in the blood, C, a low level of neutrophils, a type of white blood cells, or D, high blood pressure. Practice as a CNA, but if you've taken anatomy and physiology, if you've taken microbiology, you might know what neutropenia, what are they talking about? If you failed your test 2 times, go ahead and send your results to us at admin@fltraining.com. That's ADMIN@fltraining.com. We have to see your test results because your test results tell us your weak areas. And so we can help you come up with your study plan. So make sure you email us. Now we're going to be closed on Thursday and Friday. So get that to us sooner rather than later. Okay, so for all of you all who chose C, you know that neutropenia refers to white blood cells. And whenever someone has low white blood cells, they're at a higher risk of infection. So patients who are on chemotherapy, patients who have undiagnosed cancer disorders, that sometimes the way that we find something is wrong with them is because we will do a complete blood count. And whenever we get those results back, we see that they have a low white count. That means that something's wrong. They're not able to fight infections. That's when we call a doctor who specializes in blood, and usually an oncologist if we find the need to. So neutropenia is a dangerously low neutrophil, aka white blood cell count, that would increase the risk of infection. And so whenever someone has neutropenia, we place them on neutropenic precautions, which means that we put them on isolation, not because they're going to get us sick, but because we can get them sick. And so we have to glove, gown, mask up before we go into their room. And we can't bring any fresh vegetables, any flowers. We don't want to bring anything from outside that could be harboring germs, because again, their white counts are so low until we could make them sick while they're in our care, and we don't want to do that. Question 23. Cirrhosis primarily affects which organ? Is it A, heart, B, liver, C, pancreas, or D, kidney? Cirrhosis primarily affects which organ? I know you're going to get this. I know you're going to get this. You're going to answer this question. I am just Mrs. Meese. She didn't put A, B, or C. She said the liver. And you all are right. So read the word liver or you put B, you have it. And so this image shows What happens when a person has cirrhosis? So cirrhosis is a chronic liver disease that leads to scarring and impaired liver function, often caused by alcohol or hepatitis. And so they get so confused, especially when their ammonia levels are off. And so we call that encephalopathy. And so they can get confused. Of course, they're going to have ascites, which is all that extra fluid that's accumulated in the abdominal cavity. They can turn yellow, and that yellow color is called jaundice. And then Amy got Gabe, I hope I pronounced that right. Congratulations on passing your test, and thank you for coming back to tell us that you passed. I'm so proud of you. What a way to end the year with your CNA certification. All right, so now let me add this one to the stage. And now we're going to question 24. The term cardiomegaly means, is it A, enlarged heart, B, weak heartbeat, C, irregular rhythm, or D, heart valve disease? Cardiomegaly. You got to get that one right. I mean, the definition is there. That is right. When something is mega, it is enlarged. So cardiomegaly refers to an enlarged heart. Their heart is not going to pump effectively. Their heart is too big. And even though the heart is big, it's still not pumping properly. So those patients oftentimes end up with congestive heart failure or some type of blood pressure issues. And I'm sorry it's so loud. And we still have 25 more questions to go, but I put this slide here because if you haven't liked, shared, or subscribed with us for this long, come on, help a nurse out. Go ahead and subscribe to my channel. Give us a heart, give us a thumbs up. Let the algorithm know that there's a crazy nurse in Jacksonville, Florida, who gets on, who helps people all around the world pass their examinations. And, oh, I didn't tell you all. I have to tell you. Let me sit up straight. I got my first invitation to the YouTube studios. Finally, I'm going to LA. I'm scared. I ain't never been to LA in my life. But I'm going to LA and I'm going to YouTube studios because your girl is a YouTuber. I'm a 48-year-old content creator. Who knew? All right. So anyway, back to business. All right. All right. So everybody, question 25. Scoliosis is a condition involving, is it A, decreased bone density, B, inward turning of the knees, C, curvature of the spine, thank you, or D, inflammation of the vertebrae? When someone has scoliosis, what are we talking about? And I hope you're finding this video helpful because we have to know these terms. Our patients have conditions, and I need you as the caregivers to understand what we're talking about. So when someone has scoliosis, yes, it is C, they have a curvature of a spine, and it happens in, childhood. But imagine someone who is now older, who has osteoporosis, who also has scoliosis. They're going to be in pain. So scoliosis causes an abnormal lateral curvature of the spine, typically diagnosed in adolescence, but as we get older, we get shorter. That curvature may be more pronounced. They may have to start walking with a cane or with a walker. Julian, thank you so much. All right, question 26. Gastroenteritis. Say that with me. Gastroenteritis affects which parts of the body? Is it A, stomach and kidneys? Thank you. B, stomach and intestines. C, liver and gallbladder. Or D, kidneys and bladder. Put these words together. Gastroenteritis. Everybody got it right. I was hoping somebody would choose A. My questions are not hard enough. If you chose stomach and intestines, if you chose B, you are right. Thank you so much, Kona and everybody else there. Congratulations. Yes, gastroenteritis refers to inflammation of the stomach and the intestines. When someone has gastroenteritis, what type of meal should they be eating? Are we going to be giving them tomato soup? Are we going to be giving them orange juice? When someone has gastroenteritis, are we going to be giving them a diet that's high in citrus? What type of diet do they need? Someone said, heck no. So they're going to be on a bland diet, no spices. And so a bland diet that we commonly, you will see prescribed is called BRAT. And BRAT stands for bananas, rice, apples, and toast. Yep. So it's like really bland. Look, no seasonings there, okay? So they're going to have to allow their stomach time to rest. Question 27, and I'm so proud of you all. We have over 100 people studying with us. Hemiplegia refers to, is it A, total paralysis, B, muscle cramps, C, paralysis of the lower limbs, or D, paralysis on one side of the body? Hemiplegia. And the nurse goes wild because you all are super smart. I didn't trick you. It is half of the body. So literally, when we say hemiplegia after a stroke, half of their body is weak. So yes, you all chose the correct response. It is D. Give yourself applause. So hemiplegia is paralysis on one side of the body. Hemi means half, and plegia refers to paralysis. So it could be Bell's palsy, which sometimes affects the face. It could have been a stroke, which would affect one side of the body. So that is what we mean by when we say a person has hemiplegia. Or let's go to question 28. The term anuria means what? A-N-U-R-I-A. Does it mean A, no urine output, B, frequent urination, C, bloody urine, or D, painful urination? When you see A in front of a medical term, what does that mean? Anuria. A in front of a medical term means the absence of it. So everybody give me a different answer. Anuria. That's right. It is A. So when someone is, whenever they're experiencing body systems have shut down, they may not be producing any urine. Somebody else who won't be producing any urine is somebody who has severe kidney or bladder disease. So if their bladder is, maybe it is, it could be paralyzed, maybe from like a car accident or a motor vehicle accident. And so we'd have to catheterize them. But if they are on dialysis because of kidney failure, well, then if the kidneys aren't producing any urine, that person would be anuric. They would end up on dialysis. So as you become a nurse, right now you're a CNA, you're learning so much. But when you become a nurse, you're taught to ask questions about questions. You're always trying to think. Now, what I do need my new nurses to do is to think critically, because you're not going to pick my brain all day. I'm going to make you read a book. But you're supposed to be asking these questions. So it's like, okay, you've told me this word anuria means the person isn't producing any urine. Why wouldn't the person be producing urine? And so that's the way you're going to be thinking once you become a nurse. But right now, we're just we're learning new terms. Question 29. Thrombosis refers to A, a torn ligament, B, a blood clot, C, a cancer cell, or D, an infection. Thrombosis. So you'd have to go to YouTube to see the questions because I don't know how to do all this. So you can hear the questions, but you got to go to YouTube to see the questions. All right, so thrombosis does refer to be a blood clot. So thrombosis relates to a clot. So throm is clotting, osis is condition. Now, the difference between a thrombosis and an embolism is that the thrombose is just sitting there. It's not moving. An embolism is a clot that has now moved and is lodged in the vessel. So whenever someone has a DVT, a deep vein thrombosis, their clot could be tender. Their calf could be tender. It could be swollen, but that's localized. We have to keep them in the bed. If you start walking someone who has a DVT, guess what can happen to that clot? The thrombus can start traveling and it can travel to their brain. They can have a stroke. So when your nurse asks to travel. All right, and so Van Thor, it says, I failed 2 times. Does any help? So what you're going to do is you're going to send your test results to admin@fltraining.com. I'm trying to verify. Okay, let's see what's happening with. All right, so TikTok, I'm not sure what's happening. It's not letting me get back on the TikTok. So just one moment, you all. I'm trying to get back on the TikTok. There we go. Sorry, I didn't know the TikTok times you out. But so you're going to send an email to admin@fltraining.com. We need to see your test scores because I need to know what you're deficient in. Sometimes you don't understand terminology. Sometimes you all haven't really read. I don't know if you felt the written or the clinical. So your test results are going to help us help you. And we will come up with a customized plan so you can pass your test. Our only ask in return is that you give us a 5-star review because we're helping a lot of people pass tests. We're helping educators teach, and no one's giving us our due respect. So we want to help you, but just reach back and help us too. All right, so question 30. The term osteomyelitis. Osteomyelitis refers to, is it A, bone cancer, B, muscle inflammation, C, bone infection, or D, nerve damage? Osteomyelitis. What do we think, family? All right, we'll be looking forward to it. That is right. When someone has osteomyelitis, they have a bone infection. So itis is a little bit tricky because sometimes it's inflammation. It's like, oh, they have an infection. Well, the bone is inflamed because of the infection. And yes, osteo refers to bone. Myel, M-Y-E-L, stands for marrow. And then itis is inflammation. Question 31. Oh, this one should be easy for you all. Polyuria. Polyuria. Does mean A, no urine, B, painful urination, C, bloody urination, or D, excessive urination? Oh, we're all around the range. I see A's, I see B's, I see D's. Polyuria. Let's see what TikTok has. TikTok has D's and B's. Facebook, looks like YouTube is winning. YouTube, oh, nope, somebody started putting the wrong answer in on YouTube. TikTok's winning. So everybody, poly is more than. So think about whenever someone is dating or married to multiple people. I forgot that term, but polyamorous or something like that. So whenever something is more or excessive, we put the prefix poly in front of it. So polyuria is something that you're going to see oftentimes in those who have high blood sugars, when they have diabetic ketoacidosis. that patient's going to be urinating a lot and they're always going to be thirsty. They should be getting better once they're in our care, but maybe a family member is always urinating. They're like, I don't know what's wrong with me. I'm going to the bathroom a lot. More than likely their sugar is high. They need to go to the doctor. Excessive urination could be a sign that their blood sugars are elevated. Now, if you look at this image, this patient wet herself or himself. As a CNA, how do you prevent a patient from having an episode of incontinence? All right, so me encanta como explicas la caso. So that's me trying to read Spanish. I can't, you got to translate for me. Nurse Eunice, no habla español. That's all I know. So if anyone can translate Poppy's message, please do so, because I don't know what Poppy said. Polyamory. Okay, thank you. All right, so how does a CNA prevent someone from wetting themselves? That is right. You take them to the bathroom more frequently. Never a CNA. We do not, as CNAs, insert catheters. That would be a nurse's responsibility. So what you do is you take them to the bathroom more frequently, or if they're bed bound, you're going to give them that bedpan more frequently. So you are going to prevent episodes of incontinence by taking them to the bathroom. 32. The abbreviation TIA stands for, is it A, temporary internal aneurysm? Is it B, transient ischemic attack? Is it C, total intestinal atrophy? Ouch. What does TIA refer to in medical terms? All right, so I see you trying to give me pointers. I'm going to be spending time with you, Earth Angel, because I'm not on TikTok, and my YouTube family doesn't give me that many. They're not saying anything crazy over here on YouTube. So if TikTok's saying something, let me know. All right, yes, it's the first sign of a CVA. And so a TIA is like a mini stroke. A TIA stands for transient ischemic attack. So they have stroke symptoms, but they go away. So a TIA, so the answer is B. A TIA is often called a mini stroke and is caused by a temporary lack of blood flow to the brain. Either way, it's a medical emergency, because it's going to scare the heck out of you if now you have a headache, you're kind of dizzy, half your face or body feels numb, and then it just goes away. That's a warning sign. Get your butt to the doctor fast. Question 33. Epistaxis. Epistaxis, is a medical term for, is it A, nosebleed, B, headache, C, sinus infection, or D, swollen tongue? And that's epistaxis. Say it with me, everybody. Epistaxis. And all of my babies got it right. Oh, I'm proud of you all. Yes, it's A. Yes, it's A. It is a nosebleed. All right, your patient has a nosebleed. You have your gloves on. What position do you have them in? Do you have them squeeze their nostrils and go back? Or do you have them squeeze their nostrils and lean forward? When someone has a nosebleed, positioning is important. What position? Y'all thought y'all was going to learn some medical terminology. You're not just going to learn medical terminology. You got to learn how to do basic first aid. And guess what my book covers? It also has first aid in it too. We're going to sell this book. We're going to sell these books. So I see you all are torn between head back and head forward. So the correct response is, drum roll, please. Squeeze the nostril, lean forward. The reason why you lean forward is so that they're not swallowing their blood. If they're swallowing that blood, it's going to cause gastric upset later. Then they're going to be vomiting blood. So you squeeze the nostril, have them spit the blood out through their mouth. And of course, the nurse is going to come and they're going to put gauzes and stuff inside of the nostrils. But until the nurse gets there, you need to know what to do. So squeeze or pinch, all right? And they can breathe out their mouth. They can spit the blood out their mouth. If you do it the opposite way, how are they going to breathe and spit the blood out? It's not going to work. Sorry, I'm so animated. All right, question 34. You could apply an ice pack, but you have to wait for your nurse, you all. So I know what you want to do in home care, what you may have done in a daycare setting, but as a nurse, if my patient's nose is bleeding, is their blood pressure high? It's some other stuff. Is their nostrils dry? So you can't do any treatments as a CNA. You can of course control bleeding, but you can't do ice or heat. Your nurse has to tell you to do that. All right, and so thank you so much, Miriam. Let me show Miriam's comments. So Miriam says, I love how you explain things. I'm currently studying for my CNA. After Thanksgiving, I'll be doing my internship. I've already passed all 4 of my exams, and in January, we got to get the rest of it. Oh, I see. I'll be taking state. So congratulations in advance, Miriam. All right. So the suffix OMA, O-M-A, usually means, is it A, disease, B, infection, C, tumor, or D, pain? OMA. What are we referring to? All right, revealing the correct response in 3, 2, and OMA refers to, I see so many correct responses. It is tumor. So OMA refers to swelling or tumor, as in melanoma. So when you're giving your patients a bath and you see a wart or an area of skin that is concerning, like this shouldn't be brown and irregular, so when those edges are irregular, you want to make your nurse be made aware so that I can let the doctor know, so we can get somebody who specializes in skin to come and see that come see that patient, because that area may need to be biopsied to make sure that they don't have a cancerous lesion. So that is part of your bath. When you're in there doing that care, you're looking for abnormalities. So I know you're thinking about bruises and pressure sores. Don't forget about skin cancers too. Question 35. What does tachypnea mean? Is it A, slow heart rate, B, fast breathing, C, no heartbeat, or D, fever? Tachypnea. Thank you for the hearts and the likes, everybody. Tachypnea. I was watching your CNA videos on YouTube this week and I passed my exam. Janelle, congratulations. So proud of you. Yes, everybody, tachypnea means fast breathing. And so I chose this image, but I don't ever want to see you all giving someone a brown bag to breathe in and out of. That is what they did on the movies. I know when someone is hyperventilating due to anxiety, you will sometimes see on the movies or TV shows where they give them a bag to breathe in and out of. You all, that would be you stepping into the scope or the role of a nurse. That nurse needs to assess that patient, because it may not be anxiety. It could be fluid overload. It could be a collapsed lung. It could be pneumonia. So whenever someone has tachypnea, don't always think anxiety. It could be a medical reason, okay? So you're going to notify the nurse and do all the other things we talked about. Elevate the head of the bed, do the vital signs, and make sure that person, just knows that you're with them until that nurse can get into the room. Question 36. The root word CYT. What does that mean? Is it A, brain, B, cell, C, skin, or D, fat? CYT. That's right. Great answers. Everybody got it right. It is B, cell. So CYT is the root word for cell, as in cytology, the study of cells. And we got 13 more to go. You all have been phenomenal. You've been studying with me now for almost an hour. The term hematology means the study of, is it A, tissues, B, cells, C, blood, hematology. Earth Angel, I think the last time we talked, you didn't want to do anything in the medical field. Looks like you need to be in the medical field, Earth Angel. And that's right. So hematology, if a person has cancer, especially blood cancer, or maybe they have anemia, they're going to see a hematologist. That would be a doctor who studies what? Yes, it is C, blood. So hematology is the study of blood. Hematologist would be a physician who specializes in the study of blood. 38, this one's hard. Affects, is it A, the colon, B, bladder, C, kidney, or D, gallbladder? Cholecystitis. I see colon. That's not the correct response, but I'm happy you put a response. Cholecystitis. Yep, this one's not colon, everybody. I see a lot of A's. Cholecystitis is a tricky one. It's not A. Give me another response. And one, whenever someone has cholecystitis, their gallbladder is inflamed. So cholecystitis, chole refers to bowel, cyst is a bladder or a sac, and then itis is inflammation. So cholecystitis is inflammation of the gallbladder. Question 40. What does the abbreviation BID mean when written on a medical order? Does it mean A, twice a day, B, once a day, C, before meals, or D, with meals? What does the abbreviation BID stand for? Focus on Jesus. You're absolutely correct. I see you over there. All right. Yes, everyone has it. It is A, twice a day. So BID comes from the Latin term and it means bis and die, meaning twice a day. Question 41, diaphoresis. Say it with me, diaphoresis. Refers to, is it A, fainting, B, vomiting, C, heavy sweating, or D, muscle twitching? When we say your patient's diaphoretic, what are they doing? Your patient's diaphoretic, what does that mean? Thank you so much, Pappy, for using our resources to study and pass your examinations. I am so proud of you. And thank you for being one of our channel members. You all on YouTube, we have our channel memberships. We have our scrub, our study buddies, and then we also have Scrubs and Ambition. And so if you want to support us, support our team, we have memberships as low as $4.99 per month. We give you freebies, and we just want to thank you for your support. And yes, when a patient has diaphoresis or they are diaphoretic, heavy sweating. This is not somebody who's going through menopause. This is not a hot flu. This person is sweating profusely, and it's often due to fever or exertion. And so I know sometimes when women have hormonal changes, they'll start sweating. So just imagine you going into your patient's room, they're a little pale and they're sweating profusely. That could be a sign of low blood sugar, because they'll start sweating a lot when their sugars are low, but it could also be a sign that your patient is febrile. Either way, that would be a change of condition and your nurse has to be notified. Question 42, febrile means A, feverish, B, confused, C, diaphoretic, or D, pale. Yes, Martinez, even if you're in Jamaica, you can get the book because the book is available on Amazon, and so they ship globally. And so I hope that you and your family are doing well in Jamaica. I know there's a lot of devastation, but I'm happy that you're here studying, and so I'm going to assume that you and your family are doing fine, and that's good news. All right, so when someone is febrile, are they C, automatically diaphoretic? Don't let me trick y'all. Do not let me trick you. A person who's diaphoretic could have a fever, but when someone is febrile, they're feverish. Their temperature is elevated. So febrile means that their temperature is higher than the norm. And so we'll say the norm is the norm is 97.6 up to 99.6. So we give you leeway. Why do we give you leeway? Because Americans are special. And so we have air-conditioned cars, air-conditioned houses. And so they're going to say textbook temperature is 98.6. Well, all during the pandemic, I checked everyone's temperatures and their temperatures were 98.2, 97.8. Why? Air-conditioned. So when you're thinking about this textbook number that goes from 97.6 to 99.6, stop thinking about the United States. Think about some of our African nations that may not have air conditioning everywhere. And so it depends on where you are located in the world. With that being said, for most adults, the doctors don't care until the temperature is above 101. And so you're going to let me know. I'm going to monitor. I'm going to let the doctor know. They give some fluids. They may start treating. They may give Tylenol. But either way, when someone's temperature is higher than normal, we're going to say AKA feverish. I hope that makes sense. All right, question 43. Oh, I want to go back. The last time I was febrile, I was not diaphoretic. It was the opposite for me. I had chills. So again, just because someone who is diaphoretic has a fever, when someone is febrile, it doesn't mean they're going to be diaphoretic. It could be the opposite. They could be freezing cold. Okay. All right. So I'm off of that one. Question 43. Aphasia is the loss of A, smell, B, vision, C, coordination, or D, speech. Aphasia. Y'all are so smart. Y'all are awesome. Look, if no one told you today, you're kind, you're smart, you're rich, you're sweet, you're cute, you're handsome, and you are highly intelligent, and you know your medical terminology because, yes, aphasia stands for A. I thought it was D too. Hold on, let me go back and look at D. My computer's actually. Oh, so my number's wrong. So it is D. I just have the wrong letter there. Okay, there we go. I was like, hold up, I should know what that means. So it is D, not A. It is the lack of speech. And so in this image, this patient has a tracheostomy. And whenever a person has a tracheostomy, sometimes they have to cut into the vocal cord. And so the patient won't be able to speak until they get their synthesizer. And so as of right now, this patient is aphasic. Another person who would be aphasic will be somebody who maybe has had a stroke. And so how do you communicate? Because you still have to communicate with these patients, even though they may not be able to speak to you. How do you communicate with someone who is aphasic? Because you have to communicate. That is part of your role as a CNA. And so this patient who has a trach, who is confused, who is scared, how do you communicate with someone who can't talk back to you? Someone put tablet and paper. Yes. Don't forget about thumbs up, thumbs down, squeeze my hand, blink, nod, all of that. Because you still have to communicate with these patients. This is not the strong part of their life. They're going to need you. And so if you're just doing stuff to them and you're not talking to them, they can still hear you. They just can't respond back verbally. But they can respond with grimacing. That will let you know if they're in pain. Mrs. Lucas, before I turn you, are you in any pain right now? Thumbs up or thumbs down? Things like that. That helps to keep them involved in their care, and it shows that you're a caregiver. And in usual form, my screen froze again. All right, so question 44. The prefix enter means, is it A, inside, B, between, C, around, or D, below? And this one's kind of confusing. Enter, like interstitial. The prefix enter in medical terms. Look, Qualsum, I'm so proud of you. Yes, it is B. So intra is inside. Intra would be inside in medical terms. Peri is around. Inter is B, between. So inter is used in words like intercostal, which would be between the ribs. So when we say, hey, intercostal area, fifth rib, we're not talking about the actual rib, we're talking about the space between the ribs. So intra is in, inter, between, and peri is around. Question 45, and if you learned something tonight, or if something was reinforced, give me a heart, give me a thumbs up, give me a like. All right, so the suffix pathy means A, study, B, condition, C, disease, or D, enlargement. Pathy. Thank you for the thumbs up. You all have been studying with me for over an hour. We're going to pass these tests. We're going to pass these tests. So pathy stands for, yes, it is C. You have it there, Mega Girl. It means disease. So pathy is found in terms like neuropathy, which would be nerve disease. 46, cephalgia means A, earache, B, toothache, C, headache, D, stomach ache. Cephalgia. Everybody got it. All right, so think about Seth, think about the brain, think about headache. Yes. So CEPH, when you see that in front of the word, it's related to head. And algia is pain. 47 is hard. Hysterectomy. The hysterectomy is the surgical removal of which organ? Is it A, ovaries, B, cervix, C, vagina, or D, uterus? When a woman has a hysterectomy, what organ is being removed? Everybody got it right. I see a lot of correct answers on TikTok. We're torn between C's and D's. And let me tell you, during the hysterectomy, we're not removing her vagina. We're removing her D. It would be the uterus. So when you see HYSTR in a medical, it refers to the uterus, okay? And an ectomy will be the surgical removal. So hysterectomy is the removal of the uterus. Yes, she wants her other lady parts. Hypoxia means, is it A, low oxygen, B, high blood sugar, C, no urine output, or D, fast heart rate? Hypoxia. I can't believe you all did not watch Monday Night Football. You chose to study medical terms. When I tell you you are set apart and you're setting yourself up for greatness, you can watch the highlights of the football game tomorrow. But right now you are studying. And so I hope you are as proud of you as I am of you. And yes, hypoxia refers to A, low oxygen levels. Question 49, edema is a medical term that refers to, thank you for my flower. Is it A, muscle spasms, B, bruising, C, swelling caused by fluid retention, or D, excessive sweating? What does edema refer to? And everybody got it right. So edema, it is C. It is accumulation of fluid in the tissues leading to swelling. It is commonly seen in the legs and feet. Tell me 2 ways as a CNA that you would, if you had an order to do so, that you could reduce edema, that you could reduce swelling. I want you to pretend like you have the doctor standing right there, the orders being written. What are things that we do to reduce swelling? I see you, Earth Angel. Waiting for some more responses before we tell you what the answers are. Thank you, Evelyn. All right, your patient's legs are edematous. Oh, no ice, no ice, no ice. So ice is going to slow down circulation. So guess what's going to happen? It's not going to move. It's just going to stay. Now it's cold and hard and swollen. Earth Angel, stop giving all the answers. So elevate the legs, put those pressure stockings on, those TED hose, and if you have the order, you would have to reduce the fluids. If they are just drinking it all back on, then you can elevate the legs all day long. Now, again, you have orders for these. As a CNA, you just can't be going around making up your own orders. So, but yes, those TED hose, those compression stockings, elevation, and when that nurse assesses, she's going to let the doctor know, and we're going to get an order to limit their fluid intake. All right, so we're on our last question. Question 50. A patient with an IV site that is swollen, cold to touch, and leaking fluid is most likely experiencing, is it A, phlebitis, B, inflammation, C, hematoma, or D, infection? And yes, I am just Mrs. Me. Another way to reduce edema is to get them up and walk. That's going to move that fluid. So you are right. A patient with an IV that is swollen, cold to touch, and leaking fluid is most likely experiencing, is it A, phlebitis, B, infiltration, C, hematoma, or D, infection? And on both sides, you're torn between B's and D's. But the fact that it is swollen and cool to touch, remember, when something is infected, it's not cool. It's going to be the opposite. It's going to be hot. And it's leaking fluid. So you know what happened? The vein, the IV, more than likely, is a bad IV. And we call that infiltration, because instead of the fluid traveling throughout the body via the vein, now it's just pooling in the skin. It's going to be swollen, cool to touch, because the IV fluids are cool. All right. And so that term is infiltration, everybody. When you see an infiltration, what do? I already know you're going to let your nurse know because that's the right answer. You got to let your nurse know. All right, so infiltration occurs when IV fluids leak into surrounding tissue. It's often cool, swollen, and pale, unlike phlebitis, that would be the infection, which presents with warmth, redness, and a hard, inflamed vein due to vein irritation or inflammation. Get your nurse in the room, you all. And guess what? Yes. As I mentioned before, our book is available, and so is the QR code that's on the screen, or you can go to of effort into this book, and I'm telling you, you're going to love it. So if you, a family member, if you want to give someone a book, we greatly appreciate it. Don't forget about our channel memberships. We have Study Buddies for $4.99. We have Scrubs and Ambition, which is $10 per month, but it helps us to keep making these videos, and we appreciate you and we thank you. If you need to study your skills, because we do a lot of written practice questions on our YouTube channel, but if you need to study your skills, we have a video that shows all 22 skills, and people around the world use our videos, not to use our videos to train other people. And so if you want access to all of our CNA skills, you got to go to our YouTube channel. You go to our YouTube channel, you look for the video that says all CNA skills step by step, and you're going to see the image that you see right now on the screen. And guess what, everybody? Thank you for watching. We did it. We studied. We're going to pass our examinations. And if no one else has told you today, I love you. You are a blessing. Keep being a blessing to others. And I'm going to try to come back on before Thanksgiving. But if I don't, have a wonderful Thanksgiving. Spend time with your family and love on your family. Good night, everybody. Good night, y'all. I don't know how to turn this off. Okay, I think I got it.